Hey everybody, this is Dr. Paul Thomas with Plum Health DPC, and I'm giving a coronavirus update today. I've compiled a lot of information in this presentation, so it's pretty comprehensive. And at the end, I have a ton of questions and answers that I'm going to go through. So fasten your seatbelts. It's going to be a lot of information, but people have been asking me these questions, so I'm going to do my best to get through all of them. All right, so first up, my name is Dr. Paul Thomas. My practice is called Plum Health DPC. I've served as a subject matter expert on this topic of coronavirus throughout the pandemic, and I've made a few media appearances as I've grown my practice. I'm a speaker. I've spoken at TEDx. That's just a little bit of background about me. Currently, let's focus on where we're standing in Michigan. I'm going to throw in a couple other states as well. We had this huge surge around the holidays, mostly from people gathering around Thanksgiving, Christmas. And then once we started rolling out the vaccines in late December, we were seeing a gradual return to normalcy, getting back to lower case rates per day in the range of like maybe 1,000 cases a day. But unfortunately, some of our restrictions have been rolled back. We went from closing down restaurants to 25% capacity, now to 50% capacity. And I think we're seeing a little bit of a surge here in Michigan because of those pullbacks on those restrictions. And so we're seeing more cases here in the state of Michigan relative to other states like Kansas. They too had a big spike around Thanksgiving, Christmas, New Year's, but they've seen a gradual trend down and there has not been an uptick. And similar with Iowa, they saw a big surge around Thanksgiving, Christmas, and then gradual decline in cases over time. So I'm not really sure what's happening in Michigan, why we haven't had a more gradual decline, why we're having a spike right now. But it might be due to not vaccinating as many people relative to other states, and it may be due to kind of relaxing those restrictions on restaurants and bars. So which age group is at the highest risk of death from coronavirus? And those are the older adults in our communities. If you're 80 or older, you have basically a death rate of 14.8%. And if you're 70 or older, that death rate is 8%. That's why it's so important for all of us to become vaccinated so that we can protect older adults in our community from getting the virus. Because the virus has to come from somewhere. It's coming from maybe a janitor at the old folks home or the nurse at the assisted living facility or the priest at the church or something. It's coming from somewhere. So we all need to do our part to get vaccinated to protect our older adults in our community. So one of the questions that people have often is like, what's a comorbidity? And a comorbidity is just an underlying condition. It's important to talk about these underlying conditions because they do increase your risk of getting having severe outcomes when you have the virus or even possibly death. So we all have underlying conditions, or most all of us. About half of Americans have high blood pressure. About 2/3 of Americans are either overweight or obese, and those numbers go up every single year. And so, and many of us have like diabetes, asthma, COPD, and others. Those are the kind of underlying conditions. These underlying conditions increase your chance of dying if you get COVID-19 or coronavirus, and they also increase your chance of having a severe infection. So if you have underlying health conditions, you are more likely to be hospitalized and you're more likely to die or go to the ICU than if you don't have underlying conditions. So, among 200,000 people, there was a very high chance of hospitalization if you have an underlying health condition. But you're much less likely to be hospitalized or die if you don't have an underlying health condition like diabetes, high blood pressure, COPD, asthma, etc. So looking at the number of doses given, so we've currently given out 3.25 million doses here in the state of Michigan, but only 1.2 million Michiganders are fully vaccinated. So, percent of population that is fully vaccinated is about 12%. I grabbed this data a couple days ago, so we're probably getting close to 12.5%, 13% at this point. So this is the COVID virus or the coronavirus. And what's notable on the coronavirus are these spike proteins or these red blobs of protein. So I'm going to go into some detail about why these are important. And that's because when we make the vaccine, what we're doing is we're creating a code or like a little template, and our body uses that template to make that spike protein, okay? So when we use the mRNA vaccines that are in the lipid globule, those are the Pfizer vaccine and the Moderna vaccine, our body takes that information and makes a spike protein, and then our body sees that weird looking spike protein and makes an antibody or an immune system defense byproduct. This is basically a protein like a soldier that your body produces to take out any spike proteins that it might see. And if your body takes out the spike protein, it's going to take out the whole virus. So that's where the vaccine, that's how the vaccine works. It primes your immune system to get ready for the big virus if it were to come your way, so your body could attack it right away. It won't have time to replicate. You won't get sick, or you won't have a severe infection. You won't die. And that's how our immune system works. The other way of communicating information to your body is sending it into an adenoviral vector. So this is the adenoviral vector. The mRNA is given within the adenovirus. Your body sees that information, makes a spike protein, and then that elicits an immune response. And so all that information is important to know. And this is how the Johnson & Johnson vaccine is made, or this is the mechanism of the Johnson & Johnson vaccine. It uses this adenoviral vector. Okay, so the mRNA vaccine takes advantage of the process that cells use to make proteins in order to trigger an immune response and build immunity. And so we basically use the immune system's machinery to respond to the coronavirus. The mRNA, in simple terms, is a blueprint for the cell on how to make a spike protein that is unique for COVID-19. So in series, let's say you get the Pfizer or Moderna vaccine, you're getting basically a lipid globule or a little globule of fat with the mRNA inside of it. It's injected into your shoulder. Now, your body creates the spike protein alone, and it shows it to the rest of your immune system. Then your immune system's T cells make these antibodies, and then your antibodies are circulating throughout your bloodstream, and if a coronavirus comes into your body, your immune system attacks it. It sends these soldiers, these little antibodies, and kills the virus right away. It can't replicate. It can't cause a severe infection. So the vaccine does not create the virus inside of you. It only makes part of the protein that coats the outside of the virus, and those are the spike proteins. The cell breaks down the mRNA strand, and it never enters your cell's nucleus or affects your genetic material. Some people are concerned that, does the mRNA change my DNA? And no, it doesn't. Once your cells produce a protein, the proteins or antigen is displayed on your cell surface, and that's how your body develops that immune response. So the vaccine will alter my DNA, and that's a myth. The vaccine will not alter your DNA, and I'll show you how this works. So the mRNA vaccine is in this little lipid coat or this blob of fat, goes into your body, and it creates these spike proteins. Then your body shows these spike proteins to your immune system, and then your body, through your T cells, makes the antibodies, which then attack the COVID or coronavirus, COVID-19, if it were to enter your body. At no point does this mRNA enter your nucleus. It just goes to your cell machinery in the area of the cell outside of the nucleus to create these spike proteins. And the nucleus houses your DNA. So this mRNA never gets integrated into your DNA, which is important. We scientists like this mRNA vaccine. It's easier to produce. It's safer to produce. There's no contamination. For example, like the flu shot, we make it in chicken's eggs. So we can't give it to people with egg allergies because it's made inside of a chicken egg. And so with this, it's synthetically derived. You don't need chicken eggs to produce this. And so we're not dependent on a bunch of chicken eggs to create this vaccine. So it has a low risk of integrating into the genome. It doesn't get into your DNA. We can tweak these things to have a more rapid response to changing pandemics or emerging pandemics. There's a lower production cost, and we can adapt it to mutating pathogens. As we've already seen, we've seen like the Pfizer vaccine come out, we've seen the Moderna vaccine come out, but then later we saw the Johnson & Johnson vaccine, and that's slightly different, and it's able to take on these different variants that are circulating, which we'll talk about more as this presentation goes on. So, like all vaccines, COVID-19 mRNA vaccines have been rigorously tested for safety before being authorized in the US by the FDA. So did you know that 43,000 people volunteered in the clinical trials for the Moderna and Pfizer vaccine trials? It's really tremendous. It's really amazing. They did a vaccine trial here in Detroit at Henry Ford Hospital. There were a lot of people in the community, some of our patients, who volunteered to be a part of this heroic, historic effort to take down COVID-19. So mRNA technology is new, but we've been studying the technology for more than a decade. mRNA vaccines do not contain a live virus and do not carry a risk of causing disease in the vaccinated person. And mRNA from the vaccine never enters the nucleus of the cell and does not affect or interact with the person's DNA. So those are the key points. The next big question people have is, when will I get my vaccine? Well, we started vaccinating healthcare workers in December and January, and we're still doing that. Long-term residents of care facilities like, let's say, nursing homes, assisted living facilities, group homes, congregate settings, that all kicked off in January. Then we started vaccinating our older, more vulnerable adult population, like our geriatric population. Then we started vaccinating police officers, firefighters, EMTs, etc. We're vaccinating more and more school administrators, teachers, etc., correctional staff, inmates, other frontline workers. Here in Detroit, we just approved the vaccine for folks over the age of 50. A couple weeks ago, we started vaccinating folks over the age of 65. So we're getting to more and more people in our communities, especially here in Detroit at the TCF Center. They've been doing a great job of getting people through that center and getting people vaccinated. They've vaccinated 200,000 people so far at TCF Center here in Detroit, which is really amazing. And so as time goes on, more and more people are being vaccinated. You can go on to different vaccine finder websites to find out when you'll be eligible. If you have any doubt, contact your state health department or county health department, or like in Detroit, if you have a city health department, contact your city and they'll let you know when you are eligible. And there should be some information on their website. So who is eligible for the vaccine? We talked about that. Let's do a little compare and contrast. The Pfizer and Moderna vaccine, these are the mRNA vaccines that were produced initially. They come in that little fat globule, lipid globule. And then we have the Johnson & Johnson vaccine over here. So 2 shots are needed for the Pfizer and Moderna. 1 shot is needed for the Johnson & Johnson vaccine. They are 95%, 94%, and 85% effective in preventing severe COVID cases where you might need hospitalization. You're protected after 7 days of getting the second dose with Pfizer, 14 days after getting the second dose for Moderna, and 28 days after the Johnson & Johnson vaccine. So if you get the Johnson & Johnson vaccine, you got to wait 28 days for it to be fully effective, so for about a month. Like we said before, Pfizer and Moderna use this mRNA vaccine. Johnson & Johnson uses the adenovirus vector. What's really important about all of these is that they're all 100% effective in preventing death. So you have a 100% effectiveness for preventing death if you get the Pfizer, Moderna, or Johnson & Johnson vaccine. So what I say is the best vaccine is the vaccine that you can get, because it will 100% prevent you from dying from coronavirus. And that's a big bottom line of this entire presentation. If you get any of these vaccines, it's going to prevent you from dying. One nice thing about the Johnson & Johnson vaccine is that it's refrigerated in a standard refrigerator. You don't need the sub-zero temperatures like you need with Pfizer and Moderna. and they're all pretty inexpensive, although they're all free. If you're a United States citizen, you can go to these vaccine sites. And here in Detroit, we're making a conscientious effort to vaccinate folks who are undocumented. So that's really important as well, making sure everyone in our population is protected against COVID-19. So people are concerned. It feels like all these studies were really rushed. This came out of nowhere. Well, in fact, it took months of study. It took 43,000 volunteers in clinical settings, and we're continuously monitoring the effectiveness of the vaccine. So for example, when I got my vaccine, I got the Pfizer vaccine, I was enrolled automatically in vSafe, and I got a text message every day. Are you having any symptoms? No, I'm not having any symptoms. The next day, are you having any symptoms? No, I'm not having any symptoms. And so basically, the federal government through the CDC using vSafe or vaccine safety protocols is monitoring everyone who wants to participate. If you get the vaccine, you're enrolled in vSafe, you can report any side effects and symptoms. So it's one of the largest vaccine safety monitoring systems on the planet ever. So, it's a really marvel of modern science and technology. So based on evidence from clinical trials with 43,000 people, Pfizer vaccine was 95% effective in preventing lab-confirmed COVID cases. The Moderna was 94% effective, and there was consistent high efficacy, greater than 92% across, people with underlying medical conditions. Like I said before, if you have an underlying medical condition, you have a high risk for hospitalization and death. But if you get the COVID vaccine, you're 92% protected from getting those hospitalizations and deaths if you have underlying medical conditions. All right. Next up, the Johnson & Johnson vaccine. Some information about Michigan. We received 82,000 doses of the Johnson & Johnson vaccine. It's 72% effective in the U.S., but 83.5% effective for severe disease and 100% effective for hospitalization. Like I said earlier, 100% effective for preventing deaths. So we were talking, in the scientific community, the Johnson & Johnson vaccine might be great for people who are in transient populations, like living in one community at one time, then moving somewhere else. So for example, homeless folks, college students, migrant workers, people with substance use problems, people in the food service industry or in manufacturing settings, people who are in the hospital but being discharged to long-term care facilities. Some people can spend weeks or months in a hospital and then a long-term care facility, so it might be hard to track those people down and get them one dose now and one dose in 3 weeks. Why not just give them the one-shot deal? And that's the Johnson & Johnson vaccine. Some interesting updates, just kind of like on an uplifting note. There's only been one child flu death this entire pandemic season. And that's likely because kids aren't in school, people are wearing masks, people are washing their hands more vigorously, etc. So that's kind of a nice thing to look at. Usually we have 150, 200 deaths a year from the flu among kids, and this year we've only had one pediatric flu death. So just as a correlation to historical events, that we had this thing called polio, and kids used to get polio and die from polio, or they'd be severely debilitated. They'd spend years on an iron lung or like an external breathing apparatus because polio affects your skeletal muscles. It can shut your muscles down, and your diaphragm is a muscle that you need for breathing. So that's why kids would go into an iron lung. So if you recognize this guy, it's Elvis Presley. He's on the Ed Sullivan Show in October 1956, and he's getting the polio vaccine. A contemporary star today would be like Dolly Parton. She's saying vaccine, vaccine while getting the coronavirus vaccine via Vanderbilt Health. So this is like a really lovely moment to see, some celebrities, some politicians getting the vaccine, setting a good example for everyone. So there's some new CDC guidelines announced March 8th. And this is important, like if you're a grandparent and you've been vaccinated, now you can go and hug your grandkids. Basically, they said that fully vaccinated Americans can gather with other vaccinated people indoors without wearing a mask or social distancing. And then the recommendation also says that vaccinated people can come together in the same way in a single household with people considered at low risk for severe disease, such as in the case of vaccinated grandparents visiting healthy grandchildren or children. So for example, you're a 65-year-old grandparent, you get vaccinated, you wait that maybe 1-2 weeks or 1 month until that vaccine fully kicks in. Now you can go visit your grandkids or children. As long as it's one household, so not a lot of you, maybe like 6 of you hanging out together. That's a really lovely thing that we've seen. It's really nice. So some people on social media have said like getting vaccinated is going to be your ticket back to a normal life. Personally, I agree with that. You can visit other vaccinated people indoors, visit unvaccinated people in a single household. And then if you are exposed to coronavirus and you're vaccinated, you can skip that quarantine period. But always monitor for symptoms for 14 days. How many doses of the vaccine have been given? This is a few days old, but we're getting close to 25% of the population getting vaccinated with at least one dose. We're getting closer to 12, 13% of the population being fully vaccinated. That's a good thing. Is the vaccine safe? Yes. Over 116 million doses of COVID vaccine were administered from December 14th to March 8th. Most people have no side effects. Many people have mild side effects. So that includes pain or swelling at the injection site, headaches, chills, fever. But, you have to take that, measure those vaccine side effects from the effects of getting coronavirus, which we'll talk about later. In rare instances, people can have anaphylaxis after vaccination. That's like some people get anaphylaxis after a bee sting or after, let's say, eating peanuts or eggs. And what happens there is your throat can close up, your tissues can get edematous or full of fluid, and you can have a hard time breathing, and that can lead to death. So that's why it's important to wait that 15 minutes or 30 minutes after you get vaccinated at the hospital or at the vaccine site, and maybe let the doctor know who's giving you the vaccine, hey, I've had anaphylaxis in the past, I'd like you to keep a close eye on me. Maybe they'll keep you right next to the crash cart in case you need epinephrine or an EpiPen. If you've had a previous severe anaphylactic reaction in the past to a vaccine or to peanuts or eggs or bee venom, maybe bring your EpiPen with you or both your EpiPens with you in case that were to happen. And then, if you're in your car, honk your horn, or if you're at a site, just let the doctor know that you're having that allergic reaction. So the most common side effects from the vaccine: injection site pain, fatigue, headache, muscle pain, fever, joint pain, chills, nausea, and swelling. So it's more common to have side effects after the second dose because your immune system is ramping up its immune response. The first dose, a lot of people have no side effects. The second dose, more people have those side effects of site pain, maybe feeling fatigue or a headache. Those are the most common things that I've seen. So how long does vaccine protection last? The short answer to this is we don't know. However, the people who participated in the vaccine trials months ago have had protection for, let's say like almost 9-10 months so far. Those vaccine trials were ongoing in May, June, July. And so we're seeing folks who've been vaccinated be fully protected up until now. We haven't heard of people getting the virus after being vaccinated. So it's looking really good. We're hoping for years and years, but it could be 1 year, it could be 9 months, it could be 3 years, it could be 5 years. We just don't know because this process is ongoing. If I've already had COVID, do I need to get the vaccine? That's a big yes. Once you recover from that initial COVID infection from the virus, you want to wait like 2 weeks or a month after your symptoms have resolved, and then you should go ahead and get vaccinated. And yes, you should get both doses if you're getting Pfizer or Moderna, or you should get the one dose if you're getting the Johnson & Johnson. I recommend that, and we scientists recommend that you get the COVID vaccine after the COVID infection because we don't know how long your immune system will support you after getting the virus alone. So that's why we recommend it. Should I get vaccinated if I'm currently sick with COVID? And in short, no. You don't want to get vaccinated if you're currently sick. The idea is that your immune system is already on high alert. You could, if you get another antigen or another something coming in, like the vaccine, it could trigger your immune system to get even more triggered, and that could potentially send you to the hospital and cause an adverse effect. So we do not recommend you get the COVID vaccine if you're currently sick with COVID. Okay, if I am pregnant, can I take the vaccine? Yes. Please get the vaccine if you're pregnant. Please talk to your OBGYN. They say if you're, and this is from the American College of Obstetrician and Gynecologists, aka OB-GYNs, and they say if you are pregnant, you may choose to be vaccinated when it's available to you. There's currently no evidence that antibodies formed from COVID-19 vaccination cause any problems with pregnancy, including the development of the placenta. Okay, so if you're trying to get pregnant, if you are pregnant, if you're lactating or breastfeeding, you should get the vaccine. It will protect you, it will protect your baby as well. Should I get the vaccine if I have underlying conditions? Yes, especially if you have underlying conditions. You have a higher risk for hospitalization, you have a higher risk for death, so definitely get the vaccine. Specifically, people wonder, okay, I have rheumatoid arthritis, or I have psoriasis, or I have some kind of autoimmune condition. Should I get the vaccine? So the American College of Rheumatology put out that it appears that patients with autoimmune and inflammatory conditions are at a higher risk of developing hospitalization from COVID-19, the virus itself, compared to those in the general population. And they have worse outcomes associated with infection. Based on this concern, the benefit of COVID-19 vaccination outweighs any small possible risk of new autoimmune reactions or disease flares after vaccination. Meaning, if you get the vaccine, you may have a flare in your rheumatoid arthritis. However, that's way less concerning than getting COVID-19 virus and being hospitalized and dying, because the risk of that is greater than a flare of your rheumatoid arthritis. So that's my initial presentation. However, after I give this presentation to a group of people, I got a follow-up email with about 25 additional questions. So I'm going to go through those now with the rest of my time here. So how can the effectiveness of the vaccine be calculated if there are so many strains being discovered recently? What strain of the virus was used in the development of the vaccine? That is a great question, and it's super complex. And I'm going to try to elucidate it as clearly as possible. I watched a great video by Vox on this, so I'm going to give them some credit for this information. Will the vaccine provide any protection against the variant? So I lumped these two questions together because they're related. So like I said before, Pfizer, Moderna, and Johnson & Johnson give you 100% protection against hospitalization and death, okay? So let's be clear about that. So let's talk about variants. So Moderna was tested in August and through November of 2020. The Pfizer trials were also August through November of 2020. The Johnson & Johnson vaccine was tested October through February of 2020, October 2020 to February 2021. In this lull, there were less variants. There are fewer variants circulated in the United States. So Moderna and Pfizer are tested against, the original strain, let's say. Johnson & Johnson had much more exposure to these, UK variants, South Africa variants. So in my opinion, it's really hard to compare these two like apples and apples. They're different vaccines made at different times. So the Johnson & Johnson vaccine was tested against, the South Africa variant, the Brazil variants, and so it's potentially a stronger vaccine, but it's really hard to say because it's not like a head-to-head comparison. So 72% effective rate for preventing moderate illness in the US, but South Africa, where a highly contagious mutation of the virus is the primary form, the effectiveness was 64%. So it's really hard to answer this question because it's hard to identify the different variants because it's not like testing that's automatically done. And you're testing these vaccines at different times in different populations. So it's hard to do a head-to-head comparison. But in short, all of these vaccines are 100% effective at preventing death. So my recommendation is to take whichever one's available. How long after getting the doses, especially dose 2, should you wait to take any over-the-counter medication like Tylenol and ibuprofen? So yeah, if you're going to have a headache or if you develop muscle aches or injection site pain, you can take ibuprofen or Tylenol after taking the vaccine. You don't want to take it before because it could blunt your immune response. But you can take it, an hour or two after getting the vaccine, and that may tamp down some of those side effects, that shoulder pain or muscle aches. Of course, consult your physician. For example, you don't want to take ibuprofen if you have kidney damage or stomach ulcers, right? You don't want to take Tylenol if you have liver problems. So always talk to your doctor about this. No research has been done to look specifically at whether acetaminophen, Tylenol, or ibuprofen, Motrin, can interfere with how well the vaccine works. But earlier research suggests that it's okay to take over-the-counter pain meds at any time following receiving the vaccine. So regarding the Johnson & Johnson vaccine, can you define what adenovirus vector means? Yes. So the adenovirus vector is just another way to deliver the mRNA into your body. If you just gave mRNA naked into your body, it would just get broken down quickly. So with the Moderna and Pfizer vaccine, we put it into a fat globule that allows it to be stable in your body till it gets picked up by your cell so it can make those spike proteins. The adenovirus vector vaccine is just like they take some protein from an old adenovirus and they put the mRNA in there. That protects it as it goes in your body. It's not broken down as easily until it gets into your cell, and those spike proteins are made. So if you just inject the mRNA naked, it's going to get broken down quickly. So with Pfizer and Moderna, we put a fat globule around it. With the Johnson & Johnson vaccine, we put an adenovirus capsule around it, basically. It's like if you wanted to go to the mall this afternoon, you can take a Mercedes or you can take a Tesla. They're both going to get you there. They're going to carry passengers. They're going to carry your clothes after you finish your shopping. But they're different vehicles. And so let's say that this is the fat globule and this is the adenovirus vector. Johnson & Johnson uses the adenovirus vector. The Pfizer and Moderna uses the fat globule. Okay, we're in Detroit. We got to use a car analogy, I guess. This is just to belabor the point, but essentially we're using a viral vector vaccine for the Johnson & Johnson. We're using a fat globule for the Moderna and Pfizer. When will the Johnson & Johnson vaccine be available? It's currently available right now. Call your health department, your county, city, or state health department to find out exactly where they're distributing it. How much does having the COVID protect against the strains? So if you have the coronavirus, COVID-19, and you develop immunity, it could protect you from future infections, but it's not like a golden ticket. It's not really been studied that way. So the recommendation is once you've recovered, you should get the vaccines. Those will kind of act as an immune booster to protect you from a severe infection, hospitalization, and death. After being vaccinated, is it possible for blood donors to donate blood and to pass the protection over to the patient similar to antibodies from those who recover from COVID-19? If so, does the protection last longer than those who received antibodies from people who recovered from COVID-19? So, yeah, this is a tough one to answer, but we have used serum from recovered folks to protect people in the past. I can't really say if you donate blood, those antibodies will be passed on, maybe, but it's not really been studied yet, so I don't have a good answer for this one. Is there any method to identify if a person already has had the COVID before getting the vaccine, and does it matter if they've already had COVID? So if you've had COVID, you should wait 2 weeks to a month to get the coronavirus vaccine. And yes, there is a way to identify that. We've been doing at our office coronavirus antibody testing for a long time. So basically we take a drop of blood and we put it into this cassette, and the cassette will tell us if you've got IgG or IgM antibodies to coronavirus. And if you are positive for those antibodies, that means you've had coronavirus and you've recovered. So You can talk to your doctor about getting that test done, or you can call our office and we could do it for you. Although children don't seem to have short-term effects if they contract COVID, can they still have long-term effects? Yes, it's possible. It's possible a child could get coronavirus and it could trigger an autoimmune condition like rheumatoid arthritis. It could trigger an autoimmune condition like diabetes type 1. It could trigger an autoimmune condition like myocarditis or cardiomyopathy. The fact is we just don't know. It's likely that a lot of children are going to have a lot of long-term negative effects from coronavirus, but it's going to take us a long time to study those effects. So this is something we're going to be dealing with for a long time. That's why it's best to protect our children as best as possible by us adults getting the vaccines ourselves. What are your thoughts on the college athletes that have contracted COVID and seen swelling of the heart and the potential impacts of that? Too long, didn't read. Should we return to vigorous exercise following contracting COVID-19? So yeah, let's talk about that. JAMA, Journal of the American Medical Association, produced this research report on cardiovascular magnetic resonance imaging of competitive athletes recovering from COVID-19. They did this at Ohio State. They studied 26 athletes. 4 athletes, or 15% of the male individuals, had imaging findings consistent with myocarditis, or that's inflammation of the heart. And then 2 of those athletes had pericardial effusion, or fluid outside of the heart, after getting coronavirus. So 2 of those 4 athletes had evidence of myocardial inflammation and had mild symptoms like shortness of breath. So yes, that's scary if 7.5% of people had symptomatic cardio myopathy or myocarditis from coronavirus. Think about that. If 7.5% of everybody who got coronavirus had cardiac sequelae or problems with their heart after getting the virus, that would be a huge burden for our country to bear. And that'd be really tragic. And that is really tragic. And that's why we all need to get vaccinated so we don't see these long-term effects. Is there a way to avoid cardiomyopathy? And yes, that'd be getting vaccinated. So cardiomyopathy, if you don't know, is dilation of the heart muscle. Sometimes you can get cardiomyopathy after having long-standing high blood pressure, other problems, but we found that coronavirus is one of the factors that can cause cardiomyopathy. So if you get vaccinated, you could potentially prevent this from happening to you. Do you know if there will be a booster shot or an annual COVID-19 shot offered in the future similar to a flu shot? Yes, it's possible. I don't know if that's going to happen. They've already started talking about giving a 3rd Pfizer vaccine as a booster, months after you get your 2nd dose. We'll see. As of right now, there are 2 shots, 2 boosters for the Pfizer, 2 for the Moderna, and 1 shot for the Johnson & Johnson. But, it might be like tetanus where, every 10 years you get your, Pfizer booster of the coronavirus vaccine. It could be like that. So we'll see. It remains to be seen. Can you recommend a vitamin regimen or medication that we might use? And I think they're asking about how to prevent coronavirus. And yes, I can. There's so many good vitamins that we can get in our diet to prevent coronavirus. So if you eat a lot of zinc, like from meat, seafood, milk, whole grains, beans, seeds, nuts, it's important for wound healing. Vitamin C is good to protect against oxidative stress, chronic inflammation. That's broccoli, cantaloupes, kale, oranges. There's iron in things like spinach that helps with our immunity, non-specific immunity. Vitamin E protects against oxidative stress, and that's in nuts, seeds. Green leafy veggies, avocado, shrimp. Vitamin A, vitamin B6. We can get a lot of these things from eating healthy fruits and vegetables. So I really recommend to my patients eating healthy fruits and veggies. If you want to supplement with a small amount of vitamin C or vitamin D, that's fine too. But please talk with your doctor so you don't do a vitamin overdose and cause other problems. What are the most severe side effects reported by any of the vaccines? So we talked about this previously: injection site pain, fatigue, headaches, muscle pain, etc. I touched on that earlier in the presentation. There are severe vaccine reactions that can happen. That's namely anaphylaxis. So during the December 21st to January 10th study period, or the monitoring the vaccine adverse event reporting system, or VAERS, There were 10 cases of anaphylaxis for 4 million first doses of Moderna COVID vaccine. So that's 2.5 cases per million. So it's basically 2.5 per million have anaphylaxis. So that's a really good rate. No anaphylaxis-related deaths were reported. So that's excellent. Can you get anaphylaxis on the second dose of the vaccine and not the first? In short, yes. Some people who have been stung by a bee, several times in their life, but then the 7th time they get stung, they have anaphylaxis. So it can happen. Or, some people take lisinopril, which is a blood pressure medication. They take it for years and years, and then one day they have an anaphylactic reaction. Anaphylaxis is kind of a funny reaction by our body. We don't know why it happens in some cases, or why it happens to certain, to the 10th time you take something and not the 1 through 9 times. So it can happen. Usually with medications, anaphylaxis happens in the first 5 minutes. With bee stings, it happens in 15 minutes. With foods like salmon, happens within 30 minutes, or peanuts or eggs or whatever. So that's why we have people waiting for 15 minutes at the vaccine site to account for that 5-minute delay. Any leading indicators of anaphylaxis, like peanut allergy? That's a great question as well. They actually put out, the CDC put out this chart. Precaution of getting the vaccination. All right, let's talk about contraindications. There's no contraindications to getting the COVID vaccine. None. Zilch. Nada. If you have a severe allergy to any component of the Pfizer vaccine, don't take the Pfizer vaccine, okay? So like if you had a severe anaphylaxis on your first dose, don't get the second dose. Here's the precautions. So if you have a moderate or severe acute illness, like if you have COVID actively, or you don't want to get it if you have, you'd be cautioned about getting it if you have a history of severe allergic reactions to another vaccine. So let's say you got a tetanus vaccine and you had a severe anaphylaxis, maybe you'd take caution, okay? And that's going to be a very slim subset of the population. Maybe 1 or 2% of the population has had a severe vaccine side effect in the past. That's why it's so important for the other 80% of the population to get vaccinated, so we can protect the other people who are immunocompromised or have had a severe vaccine reaction, so we can protect everyone in the population. So you can proceed with the vaccination without any precautions if you have had food, pet, insect venom, environmental latex, or other allergies, history of allergy to oral medications, non-serious allergies. So basically, if you have any allergies other than a severe anaphylaxis to a vaccine, you should proceed with the vaccination without any precautions. Now, if you have a history of anaphylaxis yourself, be smart. Bring your EpiPen just in case. I don't think you're going to need it, as the anaphylaxis rate, as I said earlier, is 2.5 per million, but just in case, keep it on hand. All right, we got a couple more of these. A lot of questions here. While it seems there may not be any long-term effects of the vaccine, does getting the virus have any effect on your DNA or immune system? Yes, getting the virus can have a huge effect on your immune system. We saw what was called a cytokine storm that caused organ failure, hyperinflammatory syndrome, and even death. So if you got COVID and went into your lungs, caused a bunch of inflammatory signals, activated a bunch of inflammatory cells, it caused a cytokine storm and people died. So that's why we tell people to get vaccinated to prevent this. And with that cytokine storm, many organ system, many areas of the body can be affected, and you can get confusion, delirium, trouble talking, seizures, fever, anorexia, fatigue, hypertension, tachycardia, cardiomyopathy, as we mentioned earlier, from getting that cytokine storm. Okay, can you still get COVID-19 and spread it to others after getting vaccinated? That's a great question. We don't think so. And if so, there's probably a small amount of the virus that you might be carrying in your lungs, but not enough to cause a severe infection. So we don't think so. Although COVID-19 vaccines are effective in keeping you from getting sick, scientists are still learning how will vaccines prevent you from spreading the virus that causes COVID-19 to others, even if you do not have symptoms. Early data shows that the vaccines do help keep people with no symptoms from spreading COVID-19, but we are learning more as people get vaccinated. Okay. Do we have any info regarding the long-term safety of the vaccine? Yes, we do. We had 43,000 participants in these vaccine trials in the summer. The grade 3 adverse effects were fatigue and headache. So 3.8% of people had fatigue, 2% had headaches. We talked about efficacy already. COVID vaccine, long-term safety. So basically, I'm just going to talk about vaccine trials. Usually in a phase 1 trial, you have 20 to 100 vaccine volunteers, healthy volunteers. Then you go to several hundred volunteers, and then you go to 1,000 or more volunteers. And in this case, we had 43,000 people volunteer for the COVID trials. And then phase 4 is treatment. And we're currently in phase 4 right now. So we start with small, make sure there's no crazy vaccine side effects. And then you move up to a few hundred, and then you do the large trial. That's exactly what we did with these vaccines. It's been in development for over a year. And now we're seeing the fruits of these labors and getting more and more people vaccinated. And millions of Americans are reporting their side effects as we speak via this V-Safe program that I mentioned previously. Once you get the shot, you get the app, or you get some text messages. You can go onto the web browser and report any side effects. On average, what are you seeing in the length of time the vaccine provides protection for? We're seeing at least 10 months because that's when people got it, 10 months ago in the summer. We're seeing good protection from these, vaccines so far. And that's it. Oh my goodness, that was a lot of information. Thank you so much for watching and have a wonderful day. Again, this is Dr. Paul Thomas with Plum Health DPC. I don't know if you have any other questions, but if you do, please ask them. I'm happy to answer them, and have a wonderful day. See ya.